Hello and welcome. Thanks for joining us. My name is Stephen Perlin and I'm here today at UHS Sports Medicine, right on the Vestal Parkway. We're here today to talk about platelet-rich plasma therapy, which is a treatment method that can harness the body's ability to heal itself and amplify the natural growth factors that your body has to heal these tissues. We do this right here at UHS, and we are here today to talk with Dr. Stanley Hunter and UHS Strength Coach Andrew Long. Thank you for joining me, guys.
Thank you very much for having us. So we do a lot of platelet-rich plasma here at UHS. It's a great way to heal a wide range of injuries. So some of the most common things are tendon tears, arthritis, tendinosis, muscle tears, and the platelet-rich plasma, the PRP, is actually just a component of your own blood. So what we do is draw a little bit of blood, typically from the elbow, just like if you were having labs done, spin it in a centrifuge to separate it by layers. We can take the layer that has the high concentration of platelets, and then typically under ultrasound guidance to improve our accuracy and see where we're going, we inject it back into the injured area. And what platelets are famous for in your blood, they're little components of cells. When you cut yourself, they start to activate, they form a clot, they clump together, and they stop the bleeding. But another thing that platelets do is they actually have a lot of growth factors, and they release these growth factors, which stimulates the cells in the area to start growing and healing. So you regrow that skin or tendon or muscle or whatever's been torn.
Wow, I mean, that's extremely impressive. I don't know how many people are aware of this. I know I'm learning a little bit today. So that's coming right from your body, the plasma, the platelets, and that's helping yourself out, which is absolutely fantastic. And what are the general locations that this is usually used in? I know PRP injections can treat, like you mentioned, a numerous amount of conditions. Where is it most common, and where do you usually end up injecting?
Wow, it can be used for almost anything. It's used in plastic surgery and dermatology and dentistry, and we here in sports medicine use it for a wide variety of musculoskeletal things to do with joints and tendons and muscles. The most common ones that we do are arthritis for knees, hips, and shoulders, because those are very common conditions. It works great for a wide variety of tendons as well. Tennis elbow on the outside or golfer's elbow on the inside, tendinosis of the knee or the plantar fascia or the Achilles tendon. There's a huge range of areas, and it's a very safe thing. You're just injecting a component of your own blood, so you can't be allergic to it. You won't have any sort of generally bad reactions. It's just some of your own blood, and so it's worth a try in a wide range of conditions and has pretty good data supporting it.
And that brings us to Andrew. Andrew, you are one of our UHS strength coach, but you are also one of our UHS PRP injection patients. So talk to us a little bit about what made you get the first injection, how it affected you, and a little bit about what brought you to it.
Yeah, so I'm a competitive lifter, and a couple of years ago I started a powerlifting team at UHS called the Zoo. I started lifting and competing again, and Dr. Hunter started joining the team and competing with me. And I had a shoulder injury back when I was very young, and it caused my shoulder to be very arthritic. I was in constant pain. I was about to end my lifting career. I got to the point where I couldn't even open up a car door or close it. I was miserable, and Dr. Hunter stepped in and really helped me out and educated me on PRP. I'm like, I'm willing to try anything. And as soon as I got the injection, within 2 or 3 weeks out that, I felt 100% better. I was able to open my car door. I was able to come back and lift, win a national title, and then win a world title after that a couple of months. So that was my first experience with getting PRP injections. This year alone, I was competing in April. I came down with the bench press and tore my pec. And this was 6 to 8 weeks before nationals. So Hunter stepped in again. He's like, let's try this right into the pec. So he injected me right into my pec. I came back 8 weeks later to win 3 national titles this year and make it to Worlds again. So PRP has helped me in a traumatic way. It's basically saved my lifting career. I wouldn't know what I would do without it. It just makes my quality of life way better. I have less pain. I'm more active. I'm doing better at my job. I can't express enough how this injection has helped turn my life around.
This is a first-hand account, obviously, from Andrew Long, and I mean that's not a great display of what this can do and how it can help. How soon did you start feeling the effects? Is it the type of thing where you get it and it's a week later where you start feeling the effects, or is it a couple of days later where you felt kind of looser and you were able to move a little bit better?
No, the PRP injections take a little bit of time. So it usually takes about 2 to 3 weeks to kick in, but then after that, it's about 2 to 3 months of feeling great. So it's a long last. It's not a short term anything. Like I feel great for 2 to 3, sometimes even 4 months after I take the PRP injection. You know, like Dr. Hunter said, there's never been an adverse reaction to the PRP injection. I come in, they draw blood, they inject it into the site, and that's it. It takes all of 10 to 15 minutes.
I would say those timelines vary from individual to individual. Andrew here, he dislocated his shoulder when he was a teenager. He developed a lot of arthritis by the time I saw him in his late 20s. He has the shoulder of an 80-year-old inside of there. So if he gets 3 months of relief when he's doing heavy bench pressing and competing in national competitions, that's phenomenal. For many people who don't use their body quite so strenuously, they get a lot longer relief. The data would suggest that for many types of arthritis, the relief is a number of years, 1 or 2 years. And then for other types of conditions like a torn or tendinopathic tendon, an injured tendon, we can often just get the tendon to heal or the muscle to heal, and it's like it was before, and you never need another injection. Arthritis, unfortunately, it's only a matter of time. Eventually it'll come back.
Well, it sounds like it was definitely the right choice for you, Andrew, and probably for a lot of folks out there watching right now. So if you have any questions, we encourage you to come contact UHS Sports Medicine. Come in for a consultation, just call us and ask some questions. We're happy to answer them. We want to get you feeling better. Anybody with arthritis or anything like that, we want to help your quality of life, and I think this is a great way to do it. If you guys, I think, will back me up on that.
Absolutely.
Definitely.
All right, well, give us a call, and you have Dr. Stanley Hunter here and Andrew Long, the UHS Strength Coach. Thank you again for joining me today, and thank you guys for tuning in.